The world is facing chronic shortage of personal protective equipment.
Now that the world is fighting against the pandemic brought about by COVID-19, we as PAMET, with its local chapters nationwide, are called upon to do our share in our own little way, to show how we care for everyone, and we are proud that PAMET is at the forefront. It is the best time to let our medical technologists and other frontliners feel that we are here to support, to inspire, to encourage, and to lift their spirits in this very difficult time and crucial battle. We believe that by being strong, being united as one, we will win this war against COVID-19. Together, we can make a difference. Together, we can make a better world. And we are proud of you, our PAMET chapters, leaders, members, and volunteers.
There comes a time when we heed a certain call, when the world must come together as one. There are people dying. Oh, when it's time to lend a hand to life, the greatest gift of all. We can't go on pretending day by day that someone somewhere will soon make a change. We all a part of God's great big family. And the truth, you know, love is all we need. We are the world. We are the children. We are the ones who make a brighter day. So let's start giving.
There's a choice we're making. We're saving our own lives. It's true, we make a better day. Just you and me. Well, send them your heart so they know that someone cares, and their lives will be
Stronger and free, as God has shown us, by turning stone to bread. And so we all must lend a helping hand. We are the world. We are the children.
We are the one to make a brighter day, so let's start giving.
Oh, there's a choice we're making. We're saving our lives. It's true, we make a better day, just you and me.
When you're down and out, and there seems no hope at all.
Orasyo Imperata para sa COVID-2019. Ama naming mapagmahal, lumalapit kami sa iyo sa aming pangangailangan upang hilingin kami ay ipag-adya mo sa sakit na dulot ng COVID-2019 na kumitil ng maraming buhay at patuloy na kumakalat sa iba't ibang bayan at bansa. Hinihiling namin ang iyong biyaya sa lahat ng mga nag-aaral ng uri at pinagmula ng salot na ito. Patnubayan mo ang lahat ng dalubhasa sa medisina na tumutulong sa mga may sakit upang sila ay mapuno ng matibay na pagmamalasakit at pagdamay. Ipinapanalangin namin ang mga pamahalaan na naghahanap ng lunas at kagalingan para sa mga pinahihirapan ng sakit dulot ng salot na ito. Ipinagkakatiwala namin sa iyo ang lahat ng nagdurusa dahil sa sakit na ito. Pagalingin mo sila at bigyan ng mabuting kalusugan. Pukawin mo ang aming kalooban upang maging handa kaming tulungan ang mga may sakit at nangangailangan. Hinihiling namin ito sa pamamagitan ni Jesucristong anak mo na nabubuhay at naghaharing kasama mo at ng Espiritu Santo, iisang Diyos, magpasawalang hanggan. Amen. Mahal na Birhen, mapag-ampon sa mga Kristiyano, ipanalangin mo kami. San Rafael ang Arkanghel, ipanalangin mo kami. San Roque, ipanalangin mo kami. San Lorenzo Ruiz, ipanalangin mo kami. San Pedro Calungsod, ipanalangin mo kami.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, ay masaksilanganan, alam ng puso, sa likid mo'y buhay. Lupang binirang, kuyagan ang magiting, sa mandulupin, di ka pasisigil, sa nanagang tulog sa simoy at sa langit ng bagaw, ay nanagang tulakaw,
Before we start our webinar, here are some reminders and guidelines for our virtual participants. First, please observe proper webinar and video conferencing etiquette. In addition, please change your settings to speaker view. Also, you may post your questions through the link shown in your screen. Alternatively, you can also post your questions through the chat box in your Zoom console. Lastly, details on how to get your e-certificates will be flashed at the end of this webinar. We expect your adherence to these guidelines. Thank you very much. The Philippine Association of Medical Technologists warmly welcomes all of our virtual participants to the last session of our webinar series on enhancing the competencies of medical technologists on quality RT-PCR testing for COVID-19. We extend our gratitude to all of you for actively participating since our first session. This event is made possible through the initiative of our PAMET National President, the Committee on CPD, the Committee on E-Learning and Social Media Communications, and the generosity of our resource speakers, both locally and abroad. Allow me to introduce our session moderator. She is the chair of the PAMET Committee on CPD, a former national president of PAMET, and member of the PAMET National Advisory Committee. Ladies and gentlemen, dear friends and colleagues, Dr. Leila Laney Florento.
Good morning, everyone. Good afternoon, good evening to all other participants from the different countries, from other parts of the world. Welcome to our third webinar series. Today, we will have Professor Geraldine Derrick to talk about the RT-PCR process. So she will discuss how to do it and give us demonstration. She will be assisted by Professor Oliver Shane Dumawon, who is also in charge of the technicalities of this webinar. Since the start, Professor Dumawon has been with us doing all the technicalities of this webinar. Let us start. Let us welcome Professor Geraldine Derrick.
Hello. Hello, good morning, good afternoon, and good evening to all of you. Can you hear me clearly?
Yes, Ma'am Gigi.
Okay, kasi parang medyo may pagka-choppy yung pagkaka-deliver yung audio ni Ma'am Laila, kaya I would like to know kung clear po ang aking from my end. Clear naman po ba?
Yes, Ma'am Gigi.
Okay po, thank you. Maraming salamat po, Dr. Florento, para sa butihing pagpapakilala sa akin. Ngayon po, pwede na po ako managalog. Siguro naman po lahat po tayong nakikinig ngayon, even though mga nakatira po sa ibang bansa na medtech, ay marunong pong at makakaintindi po ng Tagalog. Since wala po tayong foreigner na kasama, mas malaya po akong makakapagpahayag sa salita natin, makakapagpahayag ng mga ay tuntunin, guidelines, okay, medyo makakapag-Taglish na po tayo. Okay, I would like to share this lecture. Let me see if you can you see now my slide? Hello?
Yes, Ma'am Gigi. We can see it now.
Okay po. Okay, thank you very much po. So, we are now on our third session. So I entitled this session as asking all RMTs if we are all ready. So in the first session, we have introduced the battleground. It's a war against SARS-CoV-2. So we identified our capabilities and the information that we need to perform our duties. So that is the first session. For the second session, we had identified our enemy, yung kalaban natin. So we have to make sure that this enemy, the SARS-CoV-2 virus, is really there. Okay? And then, total usong-uso po ngayon ang virtual meeting, online classes. Okay, makikiin po tayo ngayon. That's why for this third session, I would like to say that this one is a virtual encounter. So asking all RMTs if we are now ready for the battle. So at the end of this session, hopefully we would be able to understand our role in COVID-19 testing, enumerate different activities, summarize materials needed, and explain the mechanism behind those activities. And then identify sources of error encountered during COVID-19 testing, and to be able to define the remedy to be performed. And then somehow we could give you a workflow for COVID-19 testing. With that, hopefully we could develop confidence to win over the SARS-CoV-2 virus. So let's first understand our role and enumerate the different activities. In the previous sessions, we have mentioned about the different spaces that we need. So for different activities, we have identified the different spaces or dedicated spaces for each of the activities. So we have collection of the sample, the transport, and also the receiving of the sample in activation. And then we have extraction, also the master mix preparation, template addition, RT and PCR, it's a one step, and amplification plot generation. So for the collection swab or collection of the sample, we have to make use of the flax swabs with plastic or wire shaft. And then for the transport, we make use of the VTM, okay, the viral transport medium, plus the swab, highlighting the line list. So the line list must be covered in plastic envelope. Bakit kaya? Para mas madali nating ma-disinfect. Okay, ang ating line list para hindi siya mag-create ng contamination. Okay, and then in activation, so we have the VTM and the lysis buffer, highlighting the need for the use of BSC 2 type A, plus dedicated adjustable pipette tips, pipette tips with filters, microfuge tubes, MCT racks, markers, and also the different disinfectants, namely your 10% bleach and 70% alcohol. Okay, for the extraction, we have the RNA spin column, highlighting the microcentrifuge machine. Para saan to? Because in every procedure or steps in extraction, we have to make use of our microcentrifuge machine. The enumerated materials are also same from the materials in inactivation, but make sure that the materials are dedicated for this procedure. After the extraction, okay, we have our master mix preparation. We have mentioned that we have to have a separate area for this. This is a clean area. So you have to prepare this in a clean, separate room, separated from your extraction and inactivation activities. So we have to highlight the materials like your cold rack, okay, and the qPCR strip tubes, 96 well qPCR plate, forceps, and of course calculator. So the cold rack would maintain temperature for those reagents or enzymes which are sensitive to our temperature. And then calculator also for the computation of our master mix. And then we have the template addition. So in here, a separate area with dedicated materials also for template addition. So in here, we have to combine the RNA extracted, okay, that would be your RNA template, with your master mix. So highlighting the presence of the use of the vortex mixer and microfuge. So yung vortex mixer po magagamit natin para po ma-dislodge natin yung ating RNA template, okay? And magkaroon ng proper mixture with our master mix. Okay. Yung microfuge po or spin centrifuge, okay, gagamitin po natin siya para po ma-dislodge yung mga particles na adhering to the sides or on top of the tube. Okay, next would be for the activity for the RT and PCR. In here, I would like to highlight the presence of gene-specific primer incorporated already on your master mix with the RNA template. So magkasama na po specific primer, gene-specific primer, in contrast to your two-step. So basically, what we are using here, the RT-PCR, one-step po na procedure. So one step, immediately after the adding our plate with this composition, we make use of our PCR for amplification. On this case, automatic na po, makakapag-convert na po tayo ng cDNA from this RT and then magagamit na po for amplification. That is why it's called RT-PCR. Okay, so we make use of a thermocycler here. And then the result would be the amplification plot generated. So we would be using here worksheet. Okay. So I would like to explain now the mechanism behind the activity. For example, why do we need to make use of respiratory specimen? Okay, why we collect respiratory specimen? So coronavirus, okay, causes respiratory infection, thus called severe acute respiratory syndrome, coronavirus 2, which is the causative agent of COVID-19. So we can see here, directing our attention to the figure, we can see the angiotensin converting enzyme 2 or the ACE2, which is expressed by epithelial cells of the lung. So this part na yung lung ang nakafocus natin. And this serves as a receptor for cell entry and replication. So take note, yung SARS-CoV-2 virus natin would have spike protein. So in the spike protein, these are the receptor binding domain, which has a strong binding affinity to our human ACE2 or alveolar epithelial, ACE2 or your angiotensin converting enzyme 2. Okay, so in here, we could say that we could generate or collect a lot of the virus from respiratory specimen. Okay. Why nasopharyngeal flap swabs? Okay. So we are all familiar with Henry's, tama ba? So dito sa Henry's, dyan sa page 1083 ng Macpherson, okay, Henry's Clinical Diagnosis and Management by Laboratory Methods. This is the first Southeast Asian edition. Okay, so highlighting nasopharyngeal swab specimens vary considerably in quality but are adequate for nucleic acid assays. Collect swab specimens using flocked swabs with plastic shafts. Nasopharyngeal swabs or specimens obtained with flock swabs collect larger volume of samples with more numerous epithelial cells and consistently providing better samples than the fiber swab. So yan po ang ating rationale for using nasopharyngeal flock swab. Next would be the timing. Okay, I would like to highlight that timing is important. So high viral loads, according to Zhu et al. In 2020, a study wherein they were able to find high viral loads in the nose before the patient will become symptomatic. So in here, so timing, okay, is crucial. We have to consider the definition. We define first incubation period. So incubation period is defined as the interval between the potential earliest date of contact of the transmission source and the potential earliest date of symptom onset. So that is, sabi nila, 2 to 14 days after being infected. So directing our attention on this slide, so the study of Zhu further reported that there are detectable or viral loads on the even before 2 to 14 days. So we highlighted yung days 0 to before 2. So 0 to 1, meron ng detectable viral loads, okay? Dun sa area na yon. So even without symptoms, meron na tayong makukollect na samples. Okay, and take note, even without symptoms, will have the same viral loads as compared to those who are symptomatic. Okay, and on this timing na naman, we can see low viral loads. Some low viral loads on this timing. Okay? So, crucial talaga ang timing. Collection for our sample. Okay. Next would be the inactivation. So, why do we need to inactivate the sample? So, we have to make sure that the virus is non-infectious. And at the same time, it would preserve the RNA quality. Okay, so looking at this slide, okay, we can see different inactivation methods. We have the UV, heat, okay, and other chemical methods for inactivation. And going back, going back. So on this, on the image, going back on the image showing the different disinfectants, okay, all different inactivation resulted to inactivation or loss of HCV infectivity. Kasi yung sample na pinakita ko kanina ay hindi virus ng SARS-CoV-2. Virus siya ng HCV. I just don't know how to go back kasi meron siyang, oh wait, ayan. So yan, dito This is the HCV, so hepatitis C virus, yung sample na pinapakita ko dito with the use of the different inactivating agents. So in here, in the report, they said that everything, with the use of these disinfectants, inactivated ang ating virus. But highlighted here is the inactivated or the disruptive effect of heat incubation on viral envelopes and genomes, affecting also RNA replication. So we have to consider a protocol that would be compatible for the molecular analysis or the downstream testing that we need. So SARS-CoV-2 virus would use or recommend, the CDC would recommend the use of guanidinium thiocyanate, which is proven to be a good inactivating agent and very compatible to our extraction procedure. So in here, how we are going to make use of this guanidinium thiocyanate. So there would be a 10:1 ratio. Okay, so 10 chemical ml, for example, ng guanidinium thiocyanate and 1 ml ng ating sample. Okay. And then, so we have to bear in mind that we are performing this procedure under the Biological Safety Cabinet 2, type A, type A or type B, so that we are protected. At the same time, the reagent that we are going to use is indicated to be hazardous to our health. So we have to make sure that while processing this, the sample, we are also being protected. Okay, because mishandling could lead to acute toxicity. Again, we have to use biocontainment facility for this. For the extraction, okay, procedure, why do we have to do this? Okay, remember we have the inactivated sample and we have the VTM and the virus inside. Possibly there would be no virus, SARS-CoV-2, but other virus might be there. Okay, other viruses might be there. So we have to isolate, purify, and concentrate the RNA, which is our target. That is why we have to perform extraction. And on this extraction, okay, we have to effectively disrupt, okay, biological matrix. Remember, ang composition ng ating VTM ay napaka rami. May mga laman siya na like yung bovine albumin. Okay, we also have the different yung antibiotics that would prevent growth of the bacteria. So this would render contaminants on our processing for our PCR or inhibitor for our PCR. So effective disruption of biological matrix, okay, denaturation of structural proteins with nucleic acid. So take note, yung viruses would have different proteins. On our case, dito sa SARS-CoV-2 virus, we have the envelope protein, spike protein, nucleocapsid protein, and the membrane glycoprotein. So these all must be out, okay, degraded or denatured. Okay, these proteins must be denatured. Then inactivation of the different nucleases, like the RNAs or the DNAs that might be present in the inactivated sample. And then removal of contaminants. So the unwanted nucleic acids and other cellular debris. Okay, so how are we going to do that? The extraction. So from the inactivated sample, what we do spin down muna po natin siya para yung mga nag-a-adhere or from storage kasi yung some samples would go down. Okay? And then ready to add our lysis buffer. Okay? Further inactivation. That is why yung ginamit natin from our inactivation must be compatible to our extraction method. Okay? So we start from lysis and then binding. Okay? And then every after procedure that we have in here would come follow the centrifugation for proper mixing. So in binding, we can isolate and then we wash how many times depending on the protocol that we have for the extraction. So washing would render our sample purified or our RNA purified, and then we can elute the RNA. So that's concentrated. So we have already the extracted RNA. So this is the procedure for our extraction. So where are we going to perform this? Actually, we don't need to perform this inside a biological safety cabinet. Bakit? Kasi wala naman na po, inactivated na po yung virus. So safe na po. But still, we have to have a dedicated space and dedicated materials in performing this so that we could prevent cross-contamination. So I am showing you here on the slide the master mix calculation. So there would be different components for each of the reagent purchased. Okay, so the master mix, some master mix would have combined na po yung forward, reverse primer with the probe. Okay, tapos we have the TAC or the enzyme. Okay, so depende po sa protocol. We have to follow yung insert. Mahilig naman po tayo makapag-follow ng insert. But bear in mind na we are going to pipette very small amount. So, ngayon lang po tayo nakakita siguro ng ganyan kabababa na ipipipette natin. Usually, or most of the time, yung blue tip natin, so that would be 100 to 1,000 UL. So, dito po, we make use of the microliters. Okay, so we have as small as 0.3 UL. So, if the insert would tell us, okay, that we have these components available and there is a corresponding volume indicated, we have to count, okay, how many reactions can we generate. So, from receiving of the samples pa lang naman po, we could compute already kung ilan po yung ipe-prepare natin master mix. Okay, ang ginagawa po namin pagka magte-test para po ma-maximize yung sample natin, yung reagent natin, okay, nagpe-prepare na po kami for the whole day nitong master mix. Kung ilan po. Kung yan, na-anticipate namin, we are going to receive 300 samples in a day. Nakikita natin, di ba? 400, 500, gano'n. So, ko-compute na po natin yan and prepare it. Pero po, we have to take note na these are sensitive to light. Okay? So, especially po ang ating mga primers, okay, polymerases, okay, sensitive to light, and temperature. So, may protection po tayo dyan. Sa temperature po, we can make use of cold rack, as we have mentioned in the previous slide. And then, yung sa temperature po, wag na po tayong maglagay ng ilaw while we are performing. Yung light po dun sa, kung meron po tayong gagamitin na BSC. And we can also make use of covering our plate with a foil. Okay, so pag kinumpute po natin, for example, we would like to prepare the whole plate or the 96 reactions. So, imumultiply po natin lahat sila for 96 reactions. Okay, except for the RNA template. So, yun po, making sure, okay, yung total po na preparing ng master mix natin, prepared master mix natin na ilalagay natin sa tube, okay, should not exceed yung 1.5 na gagamitin nating tube. Kung saan po sila ilalagay lahat-lahat para po ma-prepare natin yung master mix. So kung may 2 ml po tayo, okay lang po. Kung may 1.5 po tayo na ml na tube, kasya po yung 1,152 UL. So, mamamaximize po natin ang ating master mix. Okay. I hope so far po nagkakaintindihan po tayo sa calculation ng ating master mix. Bakit hindi po natin ina-add kaagad ang RNA template? Remember, meron po tayong TAC dito. May polymerase na po tayo. Once na nilagay na po natin yung RNA template natin, mabilis na po yan mag-a-amplify. Okay? Since deactivated pa po ang ating TAC polymerase because we are making use of cold rack. Okay? Deactivated po siya kasi meron po tayong temperature na sinusundan. Pagka po at certain temperature, hindi po yan mag-activate. Okay? Hindi po siya mag-pre-anneal sa mga primers natin. So, make sure po na meron po tayong cold rack. Kung wala pong cold rack, meron po sana tayong, what do you call this? Yung ice na available. Okay? Para po, while we are performing this, nakalagay po yung mga tubes natin or yung plate natin on ice. Okay. Next po, on this slide, we are going to, I'm going to show you the worksheet. Okay. In here, take note na meron pong designated area po para sa ating negative control and positive control. So, distributed po yung ating negative control in both from the beginning and end of the testing. Para po malaman po natin kung meron pong contamination na nangyayari o wala. Okay? And then we also have the positive control before the negative control. Okay. So, sa worksheet po natin, we prepare this, okay, in the master mix reagent room. Okay, that would be brought to the template adding room. Okay. So, hindi, yung movement po natin is from clean to dirty. So, hindi po pwedeng bumalik po yun pagka nakadaan na po sa ating template adding room or sa amplification room. So, start po tayo yung worksheet preparation sa malinis po. So, yan po. Ito po would serve as our guide in the preparation or in the in doing our dispensing our reagents, the master mix and template adding. Okay. RNA template po natin. So, next slide. Ito po ang tinatawag nating RT-PCR. Highlighted po dito yung gene-specific primer. Okay, so ito po yung mga different composition ng ating RT. Okay, this is a one step. One step po. Upon the addition of your RNA template, okay, the cDNA is what do you call this? Yung cDNA po natin, diretso na po at maa-amplify na po sa ating thermocycler. So sa ating PCR. Remember, yung mga PCR thermocycler po natin, kailangan po lahat nasa DNA po. Since RNA po from the beginning yung sample natin, it must be converted first to cDNA. That's complementary DNA. So sana po maging malinaw po sa atin yan. Ano po yung difference ng RT-PCR one step saka two step? Yung two step po, meron po tayong primer lang po, general primer lang po sa ating first part ng sa first step natin ng well, it's two step. So sa first step po, meron po tayong machine na gagamitin natin for the generation of the cDNA. And then ito transfer po natin siya to our amplification thermocycler, for our thermocycler. So two step po 'yon. Dito po, nasa tube na po, magkakasama na po together with the gene-specific primer and the RNA template, diretso na po natin sa ating thermocycler. So ano po yung advantage ng one step over the the two step? So sa one step po, we would be able to reduce pipetting errors kasi fewer po ang pipetting steps natin dito. Okay? And ideal for high throughput platforms. Kung maramihan po yung testing na gagawin natin, mas maganda po na mag one step po tayo. Pag two step po tayo, we can store the cDNA. Yung po yung advantage naman ng two step. Okay. Faster po ang testing natin if we perform one step. Okay. So clear, hopefully clear po yan. And then, dito po sa ating thermocycler at the end, okay, actually before po, in preparation sa running po natin, dapat po we have to note of the protocol for our processing ng ating sa ating take note of the temperature, yung time and the cycle. Okay, based doon sa ating kit na ginamit, amplification kits. Okay, and then we have to properly select the fluorophore designated or specific for our gene, yung target gene natin. So in this case, may example po tayo dyan, yung ORF1AB, yung sample po natin before in the last two sessions that we have, designated po sa ating FAM. Okay, and then the engine, okay, sa ROX and RNase-P sa CY5. Okay. And then, eto na po, showing you na when we input our data and designate each of the wells, no, nakakorespond po yan dun sa created worksheet that we have provided or made during the master mix preparation. So para consistent po tayo sa ating labeling and not to be misled. Okay, so now on this slide, we are going to define, okay, the remedy to be performed. So sa collection of samples, okay, we can identify false positive. So it means contamination. So ano pong remedy natin? Dapat po may training po ang medtech, yung good microbiological practices and procedures must be performed, and biosafety practices din po. False negative po, anong mga false negative? Pwedeng early collection or too late ng collection natin because of the low patient viral load. So anong remedy? Repeat collection after a few days. And then, pwede rin pong improper collection. So there must be a training ang ating mga medtech and good microbiological techniques. Okay, comments po dito. Remember nyo po that we have mentioned before in the previous session that we combine the NPS, OPS in the same tube para ma-increase po natin ang viral samples, na detectable samples natin. Okay, we need not to use calcium alginate swabs or swab with wooden shaft kasi they contain inhibitors for our PCR testing. Next, for the transport of samples, false positive, mostly po makikita natin ang mga false positive natin usually contamination. And it should be training for our medtech must be done and good microbiological practices and procedures. So in here, sa false negative po natin, meron po tayong improper shipment na talagang nire-reject po yan minsan dun sa receiving laboratory pagka hindi po maintained at right temperature, okay? So there must be a maintenance of cold chain that is 4 to 8 degrees Celsius during transport, must be processed as soon as possible so that no further damage on our samples would happen. And for delay, kung may delay po, mag-store po tayo sa negative 70 degrees Celsius para po ma-maintain po natin yung integrity ng RNA. However, hindi po ganun kadaling magkaroon po o mayroon pong available kaagad na negative 70 sa atin. That is why we recommend na sana po we process them the soonest possible time. So in incompatible transport medium, we have to check because remedy check for the presence of inhibitors doon sa ating mga ginagamit na transport media. So on this slide also, meron akong pinapakita na triple packaging. Very important po ito. May triple packaging po sila na nilalagay po natin yung sample natin dito sa first container natin, that is your primary receptacle, and then lagay po natin siya sa secondary packaging, okay, para po for protection po, and for easy disinfection ng ating mga nare-receive na samples. Okay, and then for the inactivation, again, contamination, okay, would give us false positive result. Okay, so it is highly recommended to make use of pipette tips with aerosol barrier kasi this would prevent cross-contamination at safety rin po sa atin kasi it would pipetting and centrifugation, although in this part pipetting would create aerosol. So dapat mo meron pong barrier po. Yung pagkakakilala po natin sa ibang mga tips, wala pong aerosol barrier. So dapat po yung i-avail po natin for microbiology, for molecular biology must have aerosol barrier pipette tips. Okay, and dedicated instruments and biosafety practices. So take note also, we are performing this under the BSC2 type A. Okay, for false negative, heating method, nabanggit na po natin why we are not going to make use of inactivation, a heating method for our inactivation. Kasi easily degraded po ang ating RNA in heating. So that is why that could lead to false negative results. And also prolonged and improper storage, okay, would lead to degradation of our RNA. So we have to revise inactivation protocol as our remedy. Okay, for the RNA extraction, okay, so contamination again for false positive, but it is commented that we do not touch the tip of the spin column. Kasi po, mag-create ka ng contamination, okay? And the use of sterile forceps in getting some of the consumables while performing our RNA extraction. Okay. For our false positive results, okay, again, pagka we perform yung prolonged testing and improper storage, okay, so, and multiple freeze thawing. And at the same time, storing too long, not storing also in negative 70. So, ang remedy po natin, revise extraction protocol. So, the platform should be compatible with the downstream procedure na gagamitin natin. Okay. Next would be the master mix preparation. So, false positive results from cross-contamination and pipetting errors. Okay, pipetting errors. Kasi remember, we have minute amount, micro, nano, volume. Okay, so we have production of bubbles. Okay, must be, or formation of bubbles must be avoided. So dito, ginagawa natin ay we do spin down para at least mawala po yung bubbles available po. Wala pong bubbles na available. Okay, and then for the positive, false negative results, we have the instability of primers and denaturation of enzymes. So bakit unstable yon? Because wrong performing the master mix preparation, wala tayo sa, we don't use yung covering with foil or performing in dark areas. Okay, so we have to protect our primer and probe from light. And we have to, as mentioned, keep cold during preparation and use. Okay, another thing, improper calculation could lead to false negative result. Okay, bakit kaya? Kasi baka may mga pipetting errors tayong magawa, hindi natin ma-detect properly. Okay, so we have to do pre-labeling ng worksheet as our guide and practical practical management of resources. So dito, pagka na-compute natin siya ng tama and accordingly, kasi remember, if we prepare the master mix for the day, dapat magamit siya for the day. Hindi na siya pwede for the next day, even if we store them inside a cold or freezer temperature. So dapat within the day, freshly prepared, ika nga. Okay, for the template addition, false positive from contamination and pipetting error again. Okay, so change tips after each addition. Or else, maraming either mag-positive or mag-negative. Keep other sample wells covered. So, also yung pipetting skills, magagaling ang mga medtech dyan sa pagpapipet. So, dito, practicein natin ang micro-volume na ginagamit natin for pipetting. So, we have to also pala in molecular, kaya advantage no in molecular techniques, advantageous ang medtech in performing this technique kasi meron tayong skilled tayo in the aseptic technique and pipetting. Itong two skills are very important in performing molecular biology. Okay? So, performing molecular biology assays. Itong two techniques na inherent yung skill na to sa mga medtech na kasi galing-galing na natin mag-pipette and aseptic ang ating performance. Okay, also, take note we can use RNAs away. Bukod dun sa ginagamit nating alcohol na 70% and 10% na bleach, we could make use of RNAs away. Kasi as marami kasing contaminant ang everywhere available, ubiquitous ang RNAs. So, even in our skin, sa ating hair, ayan, on top of the table, pagka na-touch natin, ayan, easily degraded ang ating RNA with the presence of these RNAs. So, we have to have the RNAs away. Medyo mahal lang po siya. So, with this, tandem po tayo ng alcohol and frequent yung sa 70% alcohol and 10% na bleach. For the false negative, I mean, failure to add the template. Syempre, kung pwedeng hindi natin mailagay kasi sa sobrang dami. Imagine yung 96 wells na manually mong ipapipet na yung volume niya ay micro lang, 96 wells isa-isa. From the master mix, i-add mo siya and then mag-a-add ka ulit sa template. So baka ma-miss out natin siya. So focus tayo mga medtech ha. Focus tayo sa ating performance ng ating job dito. Kasi maliliit to. So we have to ensure dispense. We have to track our dispensing. Okay? So we always have to refer to our worksheet. Mas maganda yon, mas madali para makita natin siya. Mas maging tama, guided tayo. Okay, lastly, sa RT-PCR natin, so same, contamination. So remedy natin for that would lead to false positive result, no? Remedy, trained medtech, good microbiological practices and procedures, and then biosafety practices. So for your false negative, okay, eto na po. Imagine niyo garbage in, garbage out. So upstream process not compatible, definitely we would not be able to yield very good result or accurate result. Okay, we have to follow recommended and approved kits. Okay, check also if approved ng FDA. Walang palakasan system dito. Dapat ang kino-consider natin ay yung mga approved by the or the RITM in this case, approved. Okay, reliable ang ating mga kits na gagamitin. Okay, wrong choice of fluorescent reporter dye. So, also to prevent this, we have to follow reagent kits instruction. I hope malinaw po tong part na to. And at the end of that, let's try to interpret this. Okay. So in this, okay, let me since we have the tool and we have the skill, we have to bear in mind that no test gives 100% accurate result. Okay? So however, yung RT-PCR na ginamit natin have limitations when we use used to guide decision making for individual patients. So on this slide, we have 100 patients. Okay, 100 people having the risk of the disease. Okay? So we have 80%, okay, pre-test probability of 80%. So 80 people have COVID-19 and 20 people do not have the COVID-19. And then, if we perform the RT-PCR, okay, 57 people have a test result suggesting that they have COVID-19. Okay, nabilang po ba natin? And then 43 people, okay, from yung green have a test result suggesting that they do not have COVID-19. So sa testing po natin, positive po yung 57, yung blue. Tapos po 43 po yung green. Yung po yung negative sa result natin. So positive test can be useful to rule in COVID-19, while a negative swab test cannot be considered definitive. Okay, so who actually has COVID-19? Let us see. So dito sa slide na to, 56 people who test positive have COVID-19. So these are true positive, nakita po natin. So anong consequence? True positive sila, na-identify natin silang true positive, so mag-isolate sila. Okay. Yung red po, one person who test positive do not have COVID-19. False positive. Okay. So ano po ang consequence? Papag-isolatein po natin siya, hindi po siya makakaalis. Okay? Hindi po siya makakalabas. Pero false positive po siya. Okay. And 24 persons, ito pong orange or yellow sa screen ninyo, okay, who test negative, have COVID-19. So ibig sabihin, false negative po yan. Okay? No need to self-isolate and can go out and infect more people. Dangerous. 19 persons, ito po yung green natin, okay, who test negative, does not have COVID-19. They are the true negative. No need to isolate and can go out. Okay. And even they go out, they could not infect more people. Now we know the impact. On this slide, the false negative result released. Minsan po, mas nakakatakot nga pagka nag-release ka pa ng false negative eh. Ay, pagka negative, sorry. Pag-iisipan mo talaga yan. Lalo na kapag nirelease natin ng negative siya, tapos makakahawa lang. Lalabas siya, akala niya okay siya, pero makakahawa siya. Remember, dun sa slide natin kanina, even the asymptomatic has the same viral load. Okay? With those symptomatic persons. So, in here, sa laboratory results natin, okay, negative for COVID-19 infection must be combined with clinical observations, patient history, and epidemiological information. Okay, positive for COVID-19 infection, do not rule out. Okay, it doesn't mean na wala siyang bacterial infection, okay, or co-infection with other viruses. So, bear in mind, mga medtech, proper sampling procedures, good laboratory practice standard, and using high-quality extraction and real-time RT-PCR kit could improve the approach and reduce inaccurate results. Okay, in the next segment, okay, we will show the workflow for COVID-19 testing. Disclaimer lang po, ito po ay ginawa during quarantine, ECQ, so enhanced community quarantine. So we had a hard time accessing yung hospital setting. So we were able to get video or to show you a video in not in hospital setting, rather in an academic setting. So please note that this is not this is a mock COVID-19 testing video, not an instructional video, and should not be used as a sole reference. Okay, so let me share the video. So let's start with, ito po yung mga materials for disinfection muna po tayo. Okay, dito po sa video na to, pinapakita muna po natin yung mga biosafety practices, okay, disinfecting the samples that we are going to use. Okay. Sorry, the materials that we are going to use. So as a practice, okay, we have to disinfect the area prior to performing the activities. Okay. So we have the waste basket here, biohazard waste inside, we can place. Okay, and also we also have okay, biohazard near our area. Ito po are the PPEs that we are going to use. Okay. Dito po ay, meron po dyan do not access, no? Without faculty supervision. So ito po indication na academic setting po natin ito. So instead, authorized personnel only. So meron po tayong biosecurity measures, okay? Yung lock. Okay. Para authorized personnel lang po ang pwedeng makapasok. This area is your changing area. Okay. So meron po tayong proper hand washing. Okay. Yan, medyo matagal po ang hand washing natin. So ipa-move na po natin. Okay, ito na po yung donning ng ating PPEs. So available naman po sa Wi-Fi. Okay, sa YouTube yung mga proper donning and doffing of our PPEs from CDC, RITM, DOH. So we could follow those. Okay, and make our own protocol sa lab natin. Yan. Pwedeng ipa-move na po natin yan. Yan. Next would be the donning of our lab coat. Then, yung ating hair cap. And then, tingnan po natin, di ba double glove po tayo. So, meron tayong face shield. Yan po yung example ng ating suit. Okay. Outfit pagka nag-perform po tayo ng ating procedure. So, sa procedure po natin, we would start po dun sa receiving of specimen. So, dito po, nakita po natin yung line list. Yung line list po, no? Supposedly po, mas maganda po kung nalagay po siya sa plastic envelope. Kasi pag nasa plastic envelope po siya, mas madali nating di-disinfect. Yan, disinfection po ito ng container. Okay? Ang problem po yung line list natin, once na nakapasok na po dun sa dirty area, hindi na po yan pwedeng lumabas. Diyan sa area na yan. Unless mag-fumigate po tayo, pwede na po siyang ilabas. But otherwise, if that's the case na hindi tayo makapag fumigate, dyan lang po sa loob na yan ng ating area. And mas maganda po if we have computer access for the inputting of our data, yung ating line list natin, yung patient information. Ayan po, may changing ng PPEs dapat yan in every room or in every activity. Okay. So yan, pinapakita lang po natin yung ating disinfection ng ating area bago tayo mag-proceed sa checking of the received samples. So ito, yung video po na ito na po-provide natin ay somehow would give you an idea, okay, on how to go about basic biosafety procedure and yung ating good microbiological techniques. Ayan. So move natin. Yan. Si-check natin yung may criteria tayo for checking ng ating mga samples received, tapos decontamination of the samples. Okay. Siyempre kung VTM po yan, malaki po yung tubes. Okay, this part na po, yung area natin, separate area for our inactivation. Yan. So usually po parang hand washing din, no? Before and after dapat nag-disinfect po tayo ng area natin. Okay? Saka po ang safety cabinet po natin, hindi po na tinatambakan ng mga gamit. Wala po, malinis po yung loob. Wala po mga gamit sa loob na nagstay. Parang naging storage na natin. Okay, dito po yung inactivation, meron dyan po yung lysis buffer natin. Yan. As we mentioned, 10:1 po yung buffer natin dun sa ating sample. Okay. Okay, this part na po. So we assume na po na gumamit po tayo ng ibang area. Pwede po natin gawin ang extraction natin sa hindi po sa BSC. So pwede po sa labas. So since nandito na po tayo at may BSC po at naglinis po tayo prior to performing yung extraction, ito na po yung ating extraction protocol natin. So you can see po dyan yung ating spin column. Ayan. And then, in every after procedure po sa we perform centrifugation po in every adding po ng ating mga samples. Okay. Yung buffer, lysis buffer, sa binding, washing, and then yung elution buffer natin. Yan, centrifugation again. So, example lang po yan, no? Pero dapat na ma-maximize natin yung space sa ating centrifugation. Kung meron po tayong mas maliliit, okay, para po sa small quantity natin, mas maganda po yung gamitin natin. Yan. Separate din po yung sa preparation naman ng master mix. Okay, dito naman po sa preparation ng master mix, bear in mind na we have to protect our agent, yung ating mga enzymes from light, sensitive to light sila. Saka, for example, i-assume natin to na cold rack po yung gamit natin. Okay, cold rack po yan. Galing yan sa freezer. Okay. So tingnan po natin, meron po tayo ditong yung 96 well plate. Okay. So ipe-prepare mo siya sa isang tube muna, yung master mix natin. Okay. So combining all the probes, the primers, yung RNase free water natin, yung pang-fill up dun sa amount na 15 UL natin. Or depende sa protocol. For example, yung composition mo ng master mix ay 24 lang, and then you have to have 30 for example. So 30, meron ka pang for the template, no? So minus mo yung 3, 24 sa 30 with 24, 27. So meron ka pang 3 UL for your buffer. So pang fill in yung water dun sa total amount na needed natin. Yan. Ito po hindi na po natin binuo na 96. Okay, ito lang po yung for example yung sample natin. So now we go to template addition. So isa-isa rin po gagamit tayo ng ating mga dedicated pipette. Ayan, nakikita po natin yung ating pipette tips, no? May aerosol barrier. Okay. So magdi-dispense na po tayo sa nung addition po ng ating RNA template sa ating wells. Okay. Okay. Kita po natin yung second column covered po yan, no? Tapos yung first column po ang currently nag-dispensan po natin. Okay. Cover natin yung previous na column and then open the next column. Okay. If we are unsure kung contaminated po yung gloves natin, okay, pwede po tayong mag-change. Okay, o kaya mag-spray sa labas ng alcohol or RNase free, RNase away sa labas. Okay. Pero if sanay na po tayo, ayan, mas mape-prevent po natin yung cross-contamination. Sige, like that. Okay, sentry natin ang ating mga strips, PCR strips na po ngayon. Okay. And then we now go to our RT-PCR na. Yan, table and plate setup. Disregard na po natin yung wala po tayong pinopromote dito na makina. Sorry po kung may lumalabas po, hindi po natin sinasadyang makita. Okay. Yan, meron po tayong mga... Yan. O yan. Pwede po tayong maglagay sa both sides. Kapag kulang po yung sample natin, ibabalance po natin. Okay, para mas maganda po ang ating performance ng machine. Pwede rin pong sa gitna natin ilagay. Since yung RT-PCR machine naman po ay equal naman po yun. Yung sa kanyang, what do you call this? Yung sa sensor na ginagamit niya doon sa RT-PCR, yung thermocycler. Kung worry po natin yung heat distribution, better po. Kung hindi po natin mapupuno, ilagay na lang po natin sa gitna for better. Pero if mapupuno po natin, wala pong problema kung nasa side po ang ating mga samples. Same lang po sila. And then, ito na po yung choosing the right fluorophore, designation ng fluorophore for our genes. Yan. So, para pong nagle-label po tayo sa computer kung saan po natin ilalagay. Pero this is exactly the duplicate po ng ating worksheet na ginawa. Yung position po ng ating mga samples, yung negative, even the negative and the positive control. Ulitin ko po, no, ito pong video po na kinreate natin ay hindi po siya instructional video and should not be used as a sole reference. Pwede po na, kasi po hindi po siya talagang, gusto lang po namin, yung intention lang po natin ay maipakita lang po yung workflow, basic workflow, pero po hindi po kasi siya sa hospital setting. Sa hospital po talaga tayo mag-perform. Ito po ay academic setting po. Yan. Ito na po ang amplification plot natin. Okay, nakaset up na po pala yung ating sa part na yan. Yung temperature, cycles, okay. And what's that? The temperature, na-set up na po, number of cycles, okay, and then designated na po yung fluorophores natin. Ayan, ito na po yung amplification plot natin, yung result natin. So na-discuss na rin po natin how to interpret yung ating mga results in the previous sessions that we had from Dr. Kinda and Dr. Myra. We could refer to those recorded sessions. Okay, move na po natin. Yan, i-move na natin yan. So, i-print or kung meron tayong ilagay na po natin sa ating worksheet yung result po natin for our amplification plots. Okay, and then discard na po natin yan diretso. Yung ating mga amplicons. Okay, and then closing na po. Shutting down. Okay, for this video po, we would like to thank the Lyceum of the Philippines University, Batangas College of Allied Medical Professions, Genomics and Proteomics Research Unit for letting us use their facility for the mock COVID-19 testing video. So thank you very much po sa LPU. LPU po, maraming salamat. Yan. After po noon, we can do sample banking. Kung meron po tayong freezer, -70, yan po. Pwede na po nating i-keep safe ang ating mga samples. Mga extracted samples natin. Okay. Okay. So in summary, I hope we were able to understand our role in COVID-19 testing, enumerate the different activities, summarize and explain the mechanism behind those activities. So we were able to identify sources of errors encountered and define the remedy to be performed. And we were able to somehow show you the workflow for COVID-19 testing. And hopefully, sana nakakapag-develop po tayo ng confidence to win over the SARS-CoV-2 virus. So with that, okay, mga kamedtech, okay, mga katusok, in order to win the battle, we have to know our capabilities, understand our enemies, making sure that the enemy is there, and most importantly, we have to prepare. RMTs are being challenged, and we must heed to that call. We have to respond courageously, confidently, competently. So if I may ask, RMTs, are we ready? Okay, so I hope we are all ready for the battle, and we will win this battle. So with that, thank you for listening and have a nice day. Okay. And sabi ko nga po sa inyo, if hindi po nagtatapos dito ang ating learning, kasi pagka online, theoreticals, maganda kung may hands-on. So if you are interested to reserve a schedule for hands-on training, you may email pamet.elearning@gmail.com. And with your letter of intent sa grupo ninyo, pwede namin po kayong puntahan para matulungan po namin kayo para makapag-set up ng COVID-19 testing lab natin. So thank you very much and have a nice day.
Thank you very much, Dr. Gigi, for that wonderful lecture. So at this point, let's proceed to question and answers. Are you ready, Ma'am Gigi?
Ay, yes po, sir. Thank you po.
Okay
Thank
po.
you.
So let's look at the questions that were posted by our virtual participants, and hopefully we can all address them.
Hopefully po. Sa abot ng aking makakaya, sir.
Yes po. So this is the first question from Ms. Roxanne May. What is the role of the RNase-free water in the master mix?
RNase-free water kasi instead yung pang-fill up po natin yan ng master mixture natin. So in some other protocol, they make use of the double distilled water. So kung available naman po ang RNase-free water, mas maganda po yan. So ito po yung mag-fill out nung required composition natin, amount or volume for the testing dun sa ating master mix prepared. Yun po yung role niya.
Okay, so thank you. Another question po from Mr. Jason Sanchez. When to add the template? And bawal po ba na direct contact po sa eyes?
Sa teka po, unahin po natin yung question isa. Ano nga po ba yung question? Yung
Kailan daw po idadagdag yung template?
Yung template po, ina-add after ma-prepare na po yung master mix. Doon po i-add yung template. So take note po, hindi po siya same room. Nasa ibang room po. Remember po yung first session po natin, meron po mga pass box na available to limit the changing of your PPE. Kasi make sure po na meron po tayong unidirectional flow when we perform molecular assay. So yun po. So adding of RNA after the master mix. Okay. And then the next question, pag po tumama po sa ice?
No, siguro he is referring to kasi di ba under cold temperature, naka-cold block tayo. So kung bawal ba daw na direct contact sa ice, yung ating
akala ko sa mata. Okay. Ang tinatanong po natin yung RNA template.
Yeah, the template.
Yung bawal po.
Yung master mix pati.
Okay. Yung RNA template po, okay, ilalagay po natin siya kung ano naman po yung performance natin ay maayos naman po. Not necessarily po, meron po tayong area ng lalagyanan po ng tube natin for the RNA, for the template RNA. So mas maganda po kung maintain po lahat sa cold temperature. Usually po gumagamit po tayo ng bucket ng ice. Yun po, kung wala pong cold rack, no? Yung crushed ice po.
Yes.
Tapos dun po natin nilalagay yung mga tubes na ginagamit natin for adding ng template, yung tube po ng master mix, yan. So mas maganda po, we always have to maintain yung right temperature, yung cold temperature po.
Okay, so another question.
Nasagot po ba yung tanong?
Yeah, I think so. So instead, kung walang cold block, no, we can use crushed ice for that.
Yes
okay.
po. Opo.
Another question, Ma'am Gigi. For biosafety, do you recommend to use ordinary gloves during the entire process? Or is it necessary to use RNase or DNase-free gloves?
Latex po is okay. Yung latex-free na gloves, okay po yun. Double glove po tayo palagi dyan pagka nagmamanipulate po ng mga samples. So, ang ginagawa po natin for lesser contamination, we spray po yung gloves with RNase away or meron po tayong alcohol na ginagamit. Yung 70% alcohol po, pwede na po siya na gamitin. So every time po, pwede po tayo mag-spray outside, for example, sa biological safety cabinet, away po dun sa working area natin. I-spray po natin yung gloves natin. Yan po ang ginagawa natin, sir.
Okay. Siguro emphasize din natin, ma'am, no, that recommended is it should be powder-free para walang inhibitor.
Yes, powdered-free po. Yung nitrile po ay powdered-free yun. Opo.
Okay po. And then this is a question from Dr. Merlin Cruz. For negative results, does the protocol also consider checking the integrity of the RNA either by agarose gel electrophoresis or UV spectrophotometric analysis, because it's possible that wrong extraction technique could also result to either low or no RNA yield in spite of using ready-to-use kits that might affect the downstream processes.
Okay. Thank you po, Dr. Merlin. Opo, narinig ko po yan. Actually po, sa performance po ng sa research po natin, saka sa researches po, we usually confirm yung purity ng ating extracted nucleic acid through agarose gel tas spectro. Pero in this case po, dahil COVID-19 testing po ang ginagawa po natin, so mass testing po, hindi na po kasi yan na-check natin individually. So ang ginagawa po talaga niyan, diretso na po tayo sa testing na ganyan. So sa testing po ng RT-PCR without confirming kung talaga pong RNA po yung na-extract natin. Though meron pong protocol ng, for example, meron po tayong extraction control na ginagamit na pwede nating gamitin. Binibili po yon extra po para we would know kung we were able to efficiently and successfully extracted yung ating mga RNA or nucleic acid. Meron po tayong control yan. Yung human control sample po na tinatawag natin. Para
for the
ma-check
interim.
Yes, sir?
So for the interim, wala pa po siyang, for clarification, wala pang, hindi natin ini-integrate siya. Okay.
Hindi po siya integrated. So kung negative po na pareho po yung amplification result doon sa ating engine confirmatory saka sa ating screening na gene, okay, pagka pareho pong more than 40 CP or 35, ganun po yung just like explained po sa atin ng previous sessions. Okay, negative po pareho. So negative po talaga ang releasing natin ng results na yan. We also have yung control po yung RNase P. RNase P. Yan, control. So control po yan kung human samples naman po yung na-extract natin. Okay. Pero po, hindi po tayo nag-gel electrophoresis and spectro for confirmation ng purified isolated RNA po. Thank you po, Doc.
Okay, another question, Ma'am Gigi from Ben De Asis. Is it okay to use the edges of the PCR plates? Would there be potential lack of heat distribution in the cycler or sample evaporation near the edges?
Okay. Thank you po for that question. I understand po yung sinasabi niyo po na baka hindi distributed, yung well-distributed yung heat. As far as I know po, yung thermocycler po na ginagamit natin for this, yung RT-PCR po, yung thermocycler po ginagamit natin, distributed naman daw po yung heat. It just so happen po na dahil mass testing po tayo, na-fill in po lahat kasi yan. So, talaga pong ima-maximize po natin yung usage. And based po dun sa protocol natin na ginagamit, pati po yung edges would yield the same result as those placed at the middle. So, ang testing po natin ay equal po ang heat distribution natin dyan.
Yes, and I think the newest models of thermocyclers have a very high temperature uniformity sa heating block.
Yes
so
po.
This is not really much of an issue. But for older models, yes, this is quite an issue.
An issue po yan.
Yeah. So another question, Ma'am Gigi, from Dr. Annie Valdez. How much interval, like in seconds or minutes after the disinfection or decontamination, should one start with the procedure of the testing?
Okay, thank you po sa question, Doc Annie. I understand po may contact time po tayo sa disinfection. So meron pong, depende po sa protocol na gagamitin niyo. Usually po, pagka before, di ba, we disinfect, tapos we let it stay po on hold yung disinfectant natin doon sa area. Tapos that's the time na pagka sabi niyo po, tinatanong niyo kung seconds, may kita po, siguro po mga 15 minutes or 10 minutes dapat na disinfect na po natin. Pero po may assumption din po kasi na prior to using the biological safety cabinet, nalinis na rin po natin at na UV. So 10 to 15 minutes would be enough contact time for our disinfection ng biological safety cabinet or ng surfaces po natin. So mas maganda po talaga na nag-dry po siya on the area, yung disinfectant. So siguro po 10 minutes is too long na po siguro. So we just have to make sure na dried po yung area na disinfect natin before we proceed to our activity.
And also, siguro in addition to that, it depends on the disinfectant that is
Na
going to be
ginagamit.
used.
Okay.
Yeah. So whether you're using alcohol or sodium hypochlorite. Okay. So another question from one of our
Yes, sir.
participants.
That's
G.
true. Sir, if I may add pa po.
Yes
Sir,
po.
meron pa po ako idadagdag, sir. Sorry po, nabanggit nyo kasi yung disinfectant natin, no? So, be careful lang din po tayo dun sa paggamit po natin ng bleach kasi yung 10% bleach natin na pang disinfect ng area, lalo na po sa BSC kasi medyo mahal po ang BSC, magko-corrode. So, after po natin ma-disinfect using the bleach, okay, we make use po ng ating alcohol naman din po ang isunod natin para mas ma-lessen po yung corrosive effect po ng ating bleach doon sa ating safety cabinet or the surface area ng mga cabinets natin.
Okay. So another question, Ma'am Gigi, what's the reason why some samples have no amplification in the PCR, especially in the hex channel?
Ano yun? Example po ba or reality?
Yeah, so,
baka example?
Yeah, maybe.
Example po ba yun sa pinakita natin na video?
I'm not sure because ang sabi lang niya dito, why there is no amplification in the PCR.
Especially
in the hex.
If you are referring to the video, sorry po, ano po yun?
Pero in the video, I think it's the FAM that has the problem, not the hex.
Hex. Okay. Tinignan, nag-retrieve lang po kami ng mga ano doon, ng mga results doon, archive results. Pero po, if there would be no amplification, that would lead to invalid results. So, hindi po natin pwedeng i-release yan kung wala pong amplification. So, dapat po may amplification. So, depende po kung ang ginamit po natin ay hex or pwede pong wala pong amplification sa hex kung ang ginamit po natin ay ROX or CY5. Hindi po natin ginamit ang hex. Ano po ba? Hindi ko, medyo vague lang yung pagkakatanong. So, hindi ko po
siguro we just emphasize how we interpret the results based on the NTCs, the positive control.
Yes po.
Yeah.
Yun po.
Okay. Another question. I think this is more on biosafety, but this is the question of Gigi. What is the alternative for 3M N95? Kasi nauubos na po yung supply namin ng N95. 3M na fit tested, so wala na po kami alternative. Ano po ang pwedeng ma-recommend?
Depende po kung ano pong role ninyo, no? Kaya dapat po maging wise din po tayo sa usage ng ating mga PPEs. So that is why we recommend yung meron pong designated personnel. For example, dito lang po sa mag-work po para dito sa extraction or isolation, para po hindi po natin gagamitin din yung PPE natin sa ibang areas. So lessen po yung tao na gagamit. So kung isa lang po yung taong gagamit or dalawa na assign dun sa area na yon, that would really need the use of, for example, yung respirator, fit tested N95, ma-maximize po natin ang ating resources. So with the use also of the pass boxes na sinasabi natin, ma'am, lessen din yung pinakita po natin in the previous sessions, we could lessen po yung donning and doffing po ng ating PPEs from one area to another. So para po madali po nating mai-transfer na lang dun sa designated person on the area. Nasagot po ba?
I think so. Because to think about it, if you're going to do a risk assessment, the N95 might only be needed in the sample extraction maybe and receiving maybe, sample inspection, but for template addition, for master mix preparation and amplification, not so much needed.
Not so much po. Usually po, ano na lang po, surgical mask na lang po ang ginagamit sa master mix, preparation, tapos even nga po sa template addition, sa amplification po na area, surgical mask na lang po is okay kasi inactivated na po yung sample. Inactivated na po eh.
So we must practice rational use of PPEs.
Yes
and then,
po.
I think
Yes po.
other
Judicial use of our...
aside from N95, I think may other equivalent naman siya, no? Like the P2, like the from China, KN95, and so on.
Opo.
Okay. Gigi, another question. How long will the storage be of the RNA template prior to discarding?
Okay. Sa RNA po, prior to this, depende po for saan po yung use natin, kung hanggang saan po. Sa biobanking po, yung iba po kasi they would have save it usually for 2 months, 3 months, depende po sa magiging protocol po ng hospital. Kasi po if we would be storing everything sa ating fridge, sa freezer, baka po wala na po tayong mapaglagyan sa dami ng mga samples na itetest po natin. So, meron po tayong protocol na gagawin. If we say na ang protocol po natin every month, we have to discard, i-discard na po natin.
Okay, another question from Miss Elona Teologo. What is the estimated time or transition from the master mix preparation up to template adding, since they are done in different areas? Should it be done immediately?
Okay. As I have mentioned po, sensitive kasi itong template, master mix natin na na-prepare. So, dapat po ma-maintain po siya sa certain temperature. Yung po yung dapat po nasa loob na siya. Kung hindi pa po natin gagamitin kaagad, dahil yung iba po nagma-maximize yung maximize use of time. So, ina-anticipate na po nila na mag-prepare na ng master mix ahead of time. So, pwede po nating ilagay siya sa freezer in the meantime. Pero po, syempre, be careful po kasi bawal po yung freeze thawing ng ating mga ng ating prepared master mix ay could also be a factor and considered po doon sa ating testing. So once na po na pag finrelease natin and then pag kinona po natin, gagamitin na po natin for template addition. It should be within the day po. Pag maramihan po kasi ang testing, nagpe-prepare na po ng madami na anticipate na po, ilalagay na po, lalo na po kung wala pong cold rack na available. So dapat po ma-maintain po yung temperature. So ilagay lang po dyan sa freezer. Okay po tayo dyan. And then, sa template addition, kapag ready naman na po, kung immediately po na pwede na pong i-add, available na po. Ang nagtatagal lang naman po kasi dyan yung extraction kasi medyo matagal po pagka manual. Sobrang tagal po. It would take you 3 hours. Pero po may mga automated extraction machine na po na dire-diretso na po lahat. So mas mapapadali po ang buhay kung meron pong ang trabaho sa buhay natin kung magkakaroon po tayo ng automated na extraction machine. Automatic extraction, ano ba tawag dyan? Automated extraction machine. Kaso po, ang problema po natin dyan, mahal po yan at limited po yung available na machines. So, mas maganda pa rin po na tayo pa rin po ang gumawa. 3 hours nga lang po ang usually pagka isang batch po na 96 samples po ang i-extract. Umaabot po kami ng 3 to 4 hours dun po sa 96 na samples. So medyo matagal din po talaga. So mag-wait po talaga yung master mix, ilalagay muna po natin sa freezer until the time na available na po yung extracted RNA for adding and then amplification na po tayo.
Okay, thank you. Another question, this is from Mr. Mark Merto. Is there any possible way on how the medtech can recheck if the RNA template was added on the procedure during template addition?
Nako po, kung nag-fail po tayo, talagang mamimiss nyo po, ay false negative na po tayo dyan or um, ayun nga po, ay ano po, error po talaga yan. So talagang dapat
So,
po yung
dapat
medtech talaga keen on performing yung ating template adding. Kasi posible po talagang makamiss out ka ng space. Kaya dapat po talagang focus tayo doon sa ating adding ng template.
yeah.
Pasensya na po at talagang malalaman mo na lang pagdating sa dulo na ay sobra pa pala yung aking sobra pa or kulang pa yung ating. Kaya dapat talaga sir, ayun, highly recommend the use of worksheet sa side nyo po para po makita po. Doon po pwede po i-post natin doon sa glass ng biosafety cabinet while performing it or doon sa area na makikita po natin na talagang masusundan po natin. And another thing po na nakita kong tip no or technique, we can cover po yung isang strip na tapos na po. Actually yung lahat po ng strip naka-cover po 'yan. 'Di ba? Naka-cover po 'yan. Tapos pagka mag-add po tayo ng template, yung first column po, yun lang muna po ang ating tatanggalin, yung cover niya. Tapos doon po tayo mag-add. So easier po ang ating tracking ng ating dispensing. And then pag na-dispense na po yung whole column na yon, cover po natin. Next po, i-open po natin yung next column. Tapos next po, dispensing. So may mga techniques po ang mga medtech na ginagawa in order to not to lose track doon sa kanilang pipetting. Medyo masakit lang po talaga sa balikat, pero talagang tiis po yan talaga para maging maganda po ang result natin. Kung hirap na po kayo, bili na po tayo ng automated machine. extraction machine.
Saka, di ba, Ma'am Gigi, naka-body system naman sila. So, maybe another medtech
Opo.
can help guide. So, sasabihin niya kung saan ilalagay yung template para hindi siya malito yung isa.
Yes po. Actually po, isa po yan sa nire-recommend sa biosafety. May body system po. Pero po yung iba po kasing mga hospitals, wala pong enough na medtech na available pagka ganyan po. Yung mga previous po na nakita ko po na experience, talagang iisa lang po talaga ang nagpa-perform dun sa adding ng template. So, tama po, dapat po, kung hindi po tayo nagtitipid ng tao at we make sure na maganda po ang magiging result ng ating testing, at the end of the day po, mas makakatipid po tayo. Mas sakto ang ating testing. If we do that way, may body system po para to check yung testing po. Ma-double check po yung mga steps, every steps po na ginagawa po natin. Thank you po for that.
Okay, so we're down to our last 3 questions. This is a question from, wait lang po, nagumalaw siya. Do you advise the wearing of gloves during the writing and the recording of results in the laboratory? And how about the charts of patients? They are considered COVID suspect and COVID positive. Do you advise po that the charts be enclosed in plastics and the staff should wear gloves when checking the records?
Okay. Thank you po dyan. Kasi usually, based sa experience po, talagang isa po yan sa mga nagiging source ng contamination, yung ating mga worksheets. So, ganito po. Kung ang workflow po natin ay from clean to dirty, yung paper din po ay clean to dirty. So isa po 'yan sa magiging protocol natin na isasabay po yung worksheet from clean to dirty at hindi po babalik sa clean to lessen the contamination. Pangalawa po, tama po, we have to have better po kung meron pong plastic sheets, plastic to cover our sheets. Kasi po, mas easier po ang ating decontamination pagka sa plastic po. Pangalawa po, pangatlo po, if you are yung question po na naka-gloves po ba while writing po yung worksheet?
Yes.
Okay. Meron po tayong naka-double glove po tayo. So, those sa master mix preparation po, okay lang naman po single glove. Tapos, yung worksheet po na yan, depende po kung line line list or worksheet na ginawa po galing po kung saan po. Kung galing po yan sa clean area, wala po tayong magiging problema. Hindi po kailangang mabother sa ating gloves at mag-change po. Pero kung line list po yan, dapat po hindi po yan pumupunta sa master mix preparation. Doon lang po siya sa dirty area. Clear po ba tayo doon? And then, pagka po magsusulat po tayo, pagka sa clean, okay lang po na hindi mag-change ng gloves. Meron po tayong mga disinfection protocol po para po ma-lessen din po yung ating cross-contamination. Pwede po tayong mag-alcohol or mag-disinfect with mag-disinfect ng 70% alcohol spray po natin dun sa ating mga gloves na ginagamit. Yun po. Yun po yung ginagawa po natin. Even yung pen na ginagamit natin para lesser po. Pero as I have mentioned po, dedicated po. Dapat lahat sa area. So kung sa clean room po, yung worksheet sa clean room lang po nanggaling. Hindi po manggagaling sa ibang area. Doon po i-create ang worksheet sa clean area. Ngayon po yung line list, hindi po dapat pumunta sa clean area. Yung line list po, nandun lang po sa receiving area or dirty area. Tapos i-input po dyan kung may computer or everything. Tapos magke-create po tayo ng panibagong what do you call this? Hindi na po yan ibibit-bit ha, palabas dun sa area ng dirty na area. Tama po ba? Naliwanagan po ba yung nagtatanong?
I think
tungkol
so.
dyan?
Yeah. So second to the last question, Ma'am Gigi. This is a technical one.
Apo.
What should we do if the results show indeterminate? What is the possible reason for indeterminate? Siguro inconclusive to, no? Inconclusive results. Okay.
Opo, posible po na indeterminate, inconclusive. Meron po kasi, depende po sa gene na ginamit po natin. Remember po, meron po tayong, depende po kasi yan sa kit na available na ginagamit natin sa testing. So, meron po tayong ORF1AB or RDRP gene, tapos meron po tayong E and N gene. So, ito po yung mga genes na makakatulong po to indicate target genes natin for the amplification. So, na-discuss na po ito previously sa ibang sa previous sessions po natin. Pero po ulit na for example po, meron po tayong ORF1AB. Yan po yung confirmatory natin. At yung gene po natin na N gene, yan po yung screening natin. Nangyayari po ang indeterminate or inconclusive pagka po nag-positive sa confirmatory, for example, yung gene na ORF1AB, tas negative po sa N gene or E gene. Bakit po inconclusive? Kasi po, yung N gene or E gene is supposedly yung sequence po niya would target the SARS-CoV. Not specifically yung 2 na virus, SARS-CoV-2 virus. So, meron pong specific gene na i-cover po from the yung screening natin na N gene or E gene. Dapat po mag-positive yan kung magpa-positive po tayo sa confirmatory natin na ORF1AB. Kung hindi po mag-positive yung E gene or N gene, magiging inconclusive po siya. Kung positive po tayo sa N gene or E gene at negative po tayo sa ORF1AB, which is our confirmatory, ibig sabihin po, yung testing po natin na nag-positive sa N or E gene ay not SARS-CoV-2 virus, but other pneumonia-like virus. Yun po, nakuha po natin. Yun po yung ibig sabihin yun po yung possible reason for an indeterminate result or inconclusive result. Sana
okay.
po naintindihan.
So this is the last question. We have to cut the Q&A because of time constraints. What is your position, opinion regarding the pooling of samples for RT-PCR for mass testing?
Sir, paulit po. Hindi ko po
Uh,
narinig.
pooling, ma'am. Pooling of samples.
Pooling of samples. Actually, sir, meron sigurong may mga studies po na regarding sa pooling ng samples. So depende po sa magiging objective po natin. So sa akin po, para sa akin po, kung mataas po ang probability na marami pong magne-negative, tas meron pong isang magpa-positive, napakagastos po ng ating gagawin. Risky po kapag ka nag-pooling po tayo kasi individually we have to find out kung sino po yung nag-positive na yun. So, very crucial po ang pooling. So, baka po mag-end up po tayo na mag-individual testing pa rin po pagka iisa lang po ang nag-positive tas marami pong negative results. So, negative po dun sa sample na pooled. So, ay depende po kung anong objective. Yung po yung maisasuggest ko kung magpupuling po tayo. So, pero basically, ang tayo po as medtech, dito ngayon, diagnostically we are doing for our individual. Hindi po tayo nag-study for epidemiological reasons. We are doing this for clinical testing. So individual testing po tayo. So better po para po sa isang pasyente natin na malaman natin na positive o negative, yun po ang i-perform natin. Individual, hindi po tayo magpupuling.
Okay, so thank you, Ma'am Gigi. We have to cut the Q&A because of time constraint, as I said, but we will try to download all your questions and then we will forward them to Ma'am Gigi for if she can do follow-up answering of questions offline. So,
Opo, salamat din po.
yes, thank you very much, Ma'am Gigi, for that very comprehensive lecture. And on behalf of Ma'am Laila, who is in another meeting, I will be doing the synthesis for this session. So this session, which is the last of a three-part webinar series on enhancing the competencies of medical technologists on quality RT-PCR testing for COVID-19, focus on the workflow that will be done by medical technologists in performing the said assay. It was emphasized by our speaker in the lecture that the quality of the assay is dependent on several factors, but such as, for example, the infrastructure of the laboratory itself, which should be a BSL-2 facility with enhancements, the unidirectional flow of samples and reagents, and the biosafety components that should be integrated in all procedures and processes. Essential skills are needed, such as basic pipetting skills, aseptic techniques and technical factors, as well as the preparation of the master mixes, inactivation of samples, extraction of RNA, template addition, and the amplification process itself. As mentioned by Ma'am Gigi, because of the needed skills for these processes, medical technologists are in the best position to perform the RT-PCR assay. So this event is made possible through the initiative of our PAMET National President, Mr. Ronnie Puno, the PAMET CPD Committee Chair, Dr. Leila Florento, the Committee on E-Learning and Social Media Communications headed by yours truly, and of course, the generosity of our speakers both locally and abroad. At this juncture, we would like to acknowledge again the following: Dr. Ted Fajardo Jr. of the UK National External Quality Assurance System, Public Health England, Dr. Myra Hosmilio from the University of Cambridge, Department of Pathology, Department of Virology, Dr. Kidna Al-Sheikh Hamed from the London School of Hygiene and Tropical Medicine, Mr. Thomas Benedict from the University of Cambridge, Department of Pathology, Division, Department of Virology, and of course, special accolades to Dr. Geraldine Dairit from the University of the Philippines, Manila, College of Public Health, who coordinated with our other webinar faculty members and prepared the training plan for this webinar. Special mention, of course, to LPU Batangas, which was featured in the video presentation regarding the RT-PCR workflow. Lastly, of course, to our virtual participants who patiently participated in this three-part webinar series. The post-test can really be a real challenge, but despite this, we are happy to report that we have a very high passing rate for our virtual participants, which shows the effectiveness of this online learning platform in ensuring the continued professional development of medical technologists. If you all pass the 3 post test, you will garner a total of 6 CPD units, and we extend our warmest felicitations for all of those who accomplish this feat. So reminders on how to get your e-certificates for this webinar. So access to the post test is limited to those who are admitted to our online platform. For those joining us through other means of communications, access to a certificate will not be available for them. Please answer the webinar post evaluation and post test. That will be flashed in the succeeding slide. So type the links in your web browsers. Please do double check your email addresses and full name before submitting your post test. We have several problems in the past 2 sessions na mali yung naipasok na email address and full name. And of course, you're well aware, in session 1, you need to garner at least 60% score in the post test to merit an e-certificate with a single attempt. If you pass, the e-certificate will be sent to your registered email address. And of course, as you are well aware also, the link will only be open for the next 30 minutes. So maraming salamat pong muli sa lahat ng mga PAMET members, sa lahat ng mga kapwa medical technologists who have participated in this webinar series, either through our online platform or through the live streaming in our Facebook page.